The Ontario government has used its majority to pass a controversial long-term care bill, which is known as Bill 7.
The ayes being 76 and the nays being 35, I declare the motion carried.
The bill is the province's Long-Term Care Act, which will allow action to be carried out without the consent of patients or their families. That could force hospital patients awaiting a spot at a long-term care facility to be moved temporarily to a home that might not be their choice. The government fast-tracked that bill with virtually no debate and no input from the public. It says the move is needed to free up beds in hospitals which face unprecedented pressures due largely to a shortage of nursing staff. Now, several organizations are now asking the province's Human Rights Commission for an inquiry claiming age-basis discrimination. For more on this essential caregiver, we've reached Lisa Machado. She's an advocate, a caregiver, and executive producer of healthing.ca and joins us now from Toronto this morning. Welcome to the program. Appreciate your time.
Thanks so much, Anna.
Now, as I was just mentioning there, Ontario passed this long-term care bill that could force hospital patients into long-term care that's not their first choice, even if it's far from their first choice. Far from their home. What exactly does this bill mean for patients and for families?
I think that the important thing to note here is that this is just another example of how caregivers and patients are just not valued in our healthcare system. I can guarantee you that patients and caregiver advocates were not consulted in this decision.
When you look at this, do you feel that this will force families who maybe can't take on the role, but force them to take on that role of caregiver?
Absolutely. I mean, we know right now that there are roughly 35% of Canada's workforce right now is made up of caregivers. And so if you've got patients who are being just randomly shifted around to different nursing homes, it could be far away from home. We're looking at really large implications for workforces.
Yeah, so it's sometimes hard for families to find a caregiver to come into their home. So that means, as you mentioned, 35% of Canadian workforce are caregivers. But then a lot of it may fall on family members or even close friends to do that.
Oh, absolutely. I mean, and we're seeing people making those kinds of decisions now. Either they're quitting their jobs, remortgaging their houses, using their savings in order to maintain home care or even extra help because they can't do the caregiving themselves.
And of course, you have experience being a caregiver to two of your close family members. Just, explain what it was like for you.
Yes, so my mom and I were caregivers to my father, who passed away from dementia, and then also my brother, who died last year from liver cancer. And it's really tough. I mean, my mother always calls it the killer job. It really takes a lot out of you. Of course, she bore the brunt of the caregiving, but it leaves caregivers balancing a whole bunch of things. I mean, we're balancing in your employment and making sure that you're maintaining your job. But also, we're stressed. You don't get enough sleep. We don't take time for ourselves. There's a feeling of isolation. And also, you don't have time to take care of other loved ones either. And it's a very stressful existence.
And it's not that you don't want to do it either. It's just one of those things that is just really hard. And as you say, to balance all of those things, it's like juggling.
It's like juggling. And we really do not support caregivers enough in our system.
What would you like to see for support?
So I think, the most important part is to have this dialogue. So it's great that this is starting a dialogue. I would like to see more advocates involved. I think that we really need to acknowledge the value of caregivers within our system. I mean, we are valuable team members in the healthcare team, and we need to be recognized as such. I think workplaces need to understand that caregiving is going to be an increasing responsibility for their employees, and take away the stigma. Support them, support their employees, maybe even add it as a benefit, paid days off, and just acknowledging that it's okay to have this conversation and it's okay for people to say, hey, I need a little bit of help.
Yeah, and I think it's coming back to that part of the discussion too. It's stressful. It's not that you don't want to do it. It's just that there needs to be some understanding and a bit more support because, to be frank, we have an aging population right now.
That's right. That's right. And I think it's really hard for caregivers to have that discussion. It's hard to be a caregiver. Sometimes you don't want to really be a caregiver. A lot of caregivers wouldn't have chosen that role. So I think by having the conversation, we need to normalize it, especially as you mentioned, with a growing aging population. This is a conversation that we're going to be having more and more, and we should be open about it.
And, there is a growing aging population, but to open up this discussion, for sure, we saw in the cabinet shuffle yesterday, it was done to accommodate caregiving responsibilities. And I think it was brave for the minister, Philomena Tassi. She asked for a role that would be less time-consuming, shuffled to a different position because her husband suffered 2 strokes last year. When you look at this, do you hope this sort of builds a bit of the discussion around it?
Absolutely. And, I'm hoping that this shuffle is a nod to the importance of caregiving, that we're now it signals, it gives us permission to allow people to fulfill their caregiving responsibilities while maintaining their career. And imagine if this means, there isn't going to be a choice of being there for loved ones and maintaining your career, and where it's not career limiting to take time off and it's okay to ask for help.
It must be harder, though. Can you imagine if if you're not in a unionized job, you're not in a white-collar job, that you can get that time off, say you work at a fast food restaurant or things like that. What types of things could help them?
Absolutely. That is such a great, and it's a tough question. Obviously we need to put more supports in to our system, workplaces, all the things that I mentioned before, paid days off and opening the conversation. But I mean, we've seen people who, quit their jobs, right? They make the choice between caring for loved ones is a difficult decision, right? And maintaining their livelihood. And we need to make sure that no longer happens.
I thoroughly enjoyed this conversation. I think this is something that we need to continue discussing as well, like you say. Lisa Machado, thank you for your time today and, having this important topic brought forward.